Hello, everyone. Today, I want to talk about innovation in our humankind's fight against COVID-19, this pandemic. So as we know, we're entering the 20th month of start of the pandemic. And we mainly, as a humankind overall, not just the US, but I think all over the world, is two type of weapons. One is vaccine. The other is a face mask. So earlier, you heard the talk about Moderna and the Pfizer, BioNTech had the innovation in mRNA to actually as a vaccine. And we all know have achieved great success. And today, I want to talk about our effort of innovation in actually designing and developing a better face mask. So we call it invisible mask. So I'm going to take it off because I'm actually wearing an invisible mask. So let me start it why we want to have this invisible mask. As most of us have been wearing masks these days, it's almost mandatory. Governor Newsom actually just announced maybe in a few days it's going to be mandatory to wear a mask again. And while entering this building, there's a big sign of entering, you have to wear a face mask. So we said, given all this new technology in biotechnology and all this, can we design a mask that you can still breathe and you still can show your face? So we showed it that we want to back to the normal life we've been living and enjoying before the pandemic. Dealing with something really mundane is our children. Children are really the vulnerable group, but they don't follow that. They don't like wearing masks, especially when they play with other kids. And when we travel, if anybody traveled internationally or even crossed the continent to New York, wearing a mask, especially a good one, N95, it's painful. So we said, can we get rid of it? And of course, social. Yes, we wear a mask, we're in a public place. What about going home, having a little party, having a barbecue party? And we kind of miss those days that we can feel safe hanging out with friends. And of course, the young people, they want to go party in a bar, et cetera, et cetera. So we said, can we provide them a face mask that you can't really see, but also can highly specific for the virus, can protect against different variants, and so on and so forth. So that was the design goal. And of course, we watched the college football. It's really scary to see tens of thousands of screaming college kids not wearing masks. So back to this. Long story short, we actually made it. I actually have it in my pocket. This is the InvisiMask that if I pump it, it's like this. If I pump it, it's applied to my nose and will protect me for 10 hours unfortunately, if I get exposed to any the coronavirus. And in the following slides, I'm going to show you the mechanism of this invisible mask and the data and the evidence why we believe that will protect us against the viruses. So next. So what is InvisiMask and how does it work? So at the beginning, I said we want innovation in the face mask. The face mask we've been wearing is basically a physical barrier. Right. We all know it's used textile, even a filter, even with N95. It's literally based on the mechanism of a physical barrier of the viral entry into your nose, into your upper respiratory tract. And it's been shown, and again and again, that more than 95% of infection is through breathing the virus into our lungs. So we said our nasal cavity is where the battlefield is. Can we design a molecular mask at the molecular level? You cannot see the mask, but the molecules can form a layer at the molecular level again in your nasal cavity. And when the virus, you breathe in some virus, and your molecular mask can capture these viruses and protect you from the infection. So how are you going to achieve that? The core technology we use in the InvisiMask is an antibody. An antibody that can specifically recognize the SARS-CoV-2 virus which is the cause of COVID-19 disease. And so as these days, I would say almost everybody know what is the antibody. Antibody is the molecule that our taking the COVID-19 vaccine, the goal is for our body to generate antibody that can neutralize the virus. So what we did is actually, why not using all the biotechnology, clone out the antibody, make it, and give it to people in the nose so that antibody can recognize and just block the entry of the virus into our system. So first step is develop an antibody that can recognize the virus and can neutralize the viral infection. We did it. So then we would deploy the antibody into the nose, and so can form a face mask. But it actually turned out it's not that simple, because antibody, when you just spray it into your nose, it doesn't stay there for long. Because the idea is that it's just like a face mask. If you put it on, it can protect you for hours. So a key technology we developed during the pandemic is how you modify the antibody so that it can still maintain the neutralizing activity against the virus, but it can stay in your nose for hours, preferably for 10 hours. So here is, again, I know this is not a biology major audience, but this is the molecular structure of an antibody, the type of antibody that the vaccine generates in our body. So upper portion of the antibody will recognize the S1 spike protein of the SARS-CoV-2 virus, and that's the capturing part. But it's a lower part is that we modified so that it can extend the half-life in the nose. And that put it together into a nasal spray device, what I just showed you, actually, which is literally a perfume atomizer. Then you can apply the InvisiMask to yourself conveniently. So what is the science behind this? It does the antibody that you spray into your nose, does it really work? So first I want to show you that the antibody we put into the InvisiMask can effectively, 100%, can block the entry of the virus from infecting your cells. Here is an experiment showing you on the top is the COVID-19 virus, the SARS-CoV-2 virus, infecting a human cell through binding to the ACE2 receptor. The lower is that if you add the antibody to it, you can see the infection is indicated by the green fluorescence. And if you have the antibody, you got 0 infection at the cellular level. Next question is, does it really work in the live animal? So what we did is that we established the mouse model. Just like in developing any drug, you have to cure the mice first. So that's what we did. So we take a mice and apply the InvisiMask to the mice, through their nose. And then you waited for a few hours. We actually did a time course. Then you really force the infection of the virus to the mice. We drop the virus into the nose of the mice and force infection. So the infection is indicated by the fluorescence, the infection. So you can see that in the absence of antibody, no antibody, after 7 days later, the nasal cavity just flares up, just indicating how the severe infection in the nose, upper respiratory area. But also scary, you can see in the lung, they actually already infected the lung. But if we give it the InvisiMask, give it to the mice, we see 0 infection. And that is actually applied once and can last 10 hours thing. So, and how much protection you're actually providing. So in this case, we are actually challenging the mice with 10 to the 7th titer of virus. But how does that translate into real life? And they've been published in Science showing that a heavy breathing, a regular breathing from an individual who is a high emitter, a COVID-19 patient, is emitting about 1,200 particles per cubic meter, right? So you can see a 10 to the 7th virus, literally, I was saying, we did the calculation, is about, if you breathe in everything a patient emit out the virus for 3 months, you're protected by one single spray of the InvisiMask to the mice. So then back to this, then once we first developed the first generation of the InvisiMask, then the new variants start showing up. We said, oh, does this really protect the new variants? So at the time, there's a South African variants, the UK variants, then California showing up Lambda variants, and most recently, before the Omicron, I'll talk about later, is the Delta variant prevalent. So we did all this and say the same antibody, does it protect against the variants? So again, in this case, you can see the Delta variants is actually, that's the one being prevalent for the past several months around the world. And again, you can see the Delta variants will infect the mice nose area and the lung after exposure to the virus. But if you pre-treat the InvisiMask and wait for 10 hours, and we see no infection. And back to the Lambda variants, we pretty much see the same thing, that we see that the InvisiMask can protect the mice against, so far we tested against all the variants identified. Now we have a long table, about 30 different variants. Until about a week ago, the Omicron showed up, the variant showed up. So we're actively testing if the InvisiMask can protect against the Omicron virus. We probably will have the data in about 2 weeks. Well, we had our first generation of this InvisiMask last November. That was actually before the vaccine became available. So we gave it to myself, actually, and our friends and family as added protection. So here I'm showing you the testimonials of the people who actually use the InvisiMask. So far we have about a few hundreds of people have used it so far. What I really want to point out is that a patient, a heart transplant patient, who's been using it for the past 12 months, a key factor you probably know, patients who have a heart transplant, they are immune compromised. So which means that they won't generate sufficient antibody even though they are fully vaccinated. So for this group of people, one of the patients been using InvisiMask, being actually very happy about this added protection because they're deficient in vaccine approach. And also the senior, one 83-year-old retired physician, fully vaccinated, and she's been using this InvisiMask every time she goes out or every time she sees some visitors to her home. So it goes on and on. So now it's actually, we do have a product. We can, my company emphasize why I'm in this. So I'm the founder CEO of Eureka Therapeutics. We are oncology immunotherapy company. We're developing treatment for cancer. And one key technology platform we use for developing those immunotherapy is antibody discovery. So far we've been, as a company, we sent 4 different antibodies to human trials for oncology purposes based on the platform. So when we were locked up last year, we're saying, what can we do? Can we utilize our antibody technology and develop something new, something innovative to fight the COVID-19? And this InvisiMask actually came from our antibody, proprietary antibody platform. So, so later on, we actually I showed you earlier, this can protect against multiple variants. And most importantly, that we sent it out to third party to do validation. And we showed this COVID, the consortium supported by Bill Gates Foundation is the centralized testing center for testing how good is your antibody that can neutralize the SARS-CoV-2. And also, we give the antibody to Gladstone Institute at UCSF, who actually tested the antibody against a live SARS-CoV-2 virus and confirmed our finding. So in the end, I just want to stop here and just saying we actually have gone through all this idea stage, design stage, discovered the antibody, developed the proprietary technology that can enable the antibody to stay in the nose cavity and form this molecular mask. And we showed you we had gone through the cellular testing of this approach, gone through we protect the mice now successfully, and be giving it to people to use it. Our next step challenge is to actually how to bring it to the whole society, and not just in the US, and actually to the whole world. So we're actively working with the government, with partners, and with investors to do this. It's actually a mind-boggling challenge, because giving out to a few hundred people is one thing. Now we're being able to provide like to 100,000 people scale. But once you make it available to the whole world, we're talking about hundreds of millions. Just the scale, the mass production, the supply chain becomes mind-boggling. That's what I've been dealing with. So thank you for the opportunity to share our innovation here, and hope together we can really succeed in control the spread of COVID-19. Thank you.